So good afternoon, everyone. It's wonderful to get the opportunity here this afternoon to talk a little bit about how innovative cities can improve health and quality of life for people with serious mental illness. And I'd like to introduce a little bit about how we are going to be running the session here. So Dr. Prabha Chandra from NIMHANS India and I are going to be the moderators. We are first going to introduce ourselves and a little bit about what this panel is about. And then Prabha is going to be introducing all the panelists, and we are going to go around and ask questions. And after which we are hoping that we will have a lot of time left to have a much more interactive engagement with all of you. So with that, I'm going to segue into this session. And what we are hoping that we do in this conversation is really bring to life a lot of very specific, tangible examples of the different types of innovative work that's happening in cities across the world. And we are very fortunate to have a number of amazing panelists here from India, Kenya, and the US. And through some of their work and through some of the other examples, we hope that we can bring to you how cities can become the gateways and a lot of the leadership of action that can happen for serious mental illness. So why cities, and why did we choose that as a focus of today's conversation? So as we all know, given the amount of urbanization and displacement that's happening in today's world, the statistics are huge. So about 54% of today's population live in cities, and that number is projected to be about 66% by 2050. And not only that, a huge bulk of this population, about 60%, is projected to be age 18 by 2030. So along with all these urbanization, displacement, and other trends, what's happening is that there's tremendous pressure on the infrastructure and resources, and cities are becoming, in some ways, places where a lot of the issues, you're seeing a much more magnified impact. And along with the existing pressures that a person experiences in their life journey, there's increased stresses that a person faces. So in some ways, while cities are facing increased pressure, they have also become the places where a lot of innovations are happening. And because of the richness of different stakeholders, the formal, informal sectors, what we are seeing from New York to Nairobi to Chennai, in different places across the world, there's a lot of amazing innovative work that's happening. So what we hope to emphasize in today's afternoon discussion is highlight some of the problems, but more importantly, a lot of the solutions that are emerging, and what is it that we can learn from some of the conversations today, and how do we take that forward to take on a very, very important issue. So with that, just a quick introduction to myself. I'm Moitreyee Sinha. I'm the CEO of citiesRISE. We started this platform a couple of years back, recognizing the potential that cities have to essentially come behind some of the big issues of humanity. We've seen this kind of work happen in climate change, in a number of other areas, and this was essentially the reason for the notion of RISE in terms of rising up to the challenge. And it's cities for, not just for cities, but for humanity, so that's been the purpose. And a lot of the commitment has been to the life course perspective about the importance of the life journey, and therefore the focus on young people. With that, I'm going to request Prabha. Prabha and I are going to be moderating the session here. And I had the privilege of meeting Prabha a couple of years back. And since then, we've been talking about the importance of urban planning, the importance of many, many other ways cities can lead change. And with that, Prabha, I'm going to request you to introduce yourself as well as the panelists, and then we can go from there.
Thank you, Moitreyee, and it's great to be here, and I thank Fountain House for holding this wonderful two-day event. So my name is Prabha Chandra. I'm a psychiatrist, and I head the department at the National Institute of Mental Health and Neurosciences in Bangalore in India. And I've been associated with citiesRISE for the last 2 years. And I strongly believe that cities have the capability of providing for everybody, provided people from the city get involved and they bring in meaningful participation in the whole planning of a city. And that's where I think we resonate, the citiesRISE and working in cities. We have a great panel today, and what we're going to focus on is the various action points that have happened, various interventions that have been taking place in cities. Some of the cities where resources are not plentiful, but still the passion that has driven people to make things happen. So we're going to learn a lot from our panelists. We have I'll start with Tasneem. Tasneem brings in a lot of sensibility from India. She works, she's a mental health professional. She's a lead for Tata Trusts, which runs several programs in India. And she's from a place called Nagpur, which is a large city in central India. And she will be telling us about some of the innovations that she's brought on. We have Pamela Collins, who's the professor of psychiatry and global health at the University of Washington. She's also director of research for citiesRISE. We have all met Gary Belkin earlier, and he's the executive deputy commissioner of health and mental hygiene for New York City's Department of Health and Mental Hygiene. We have Dr. Simon Njuguna from Kenya, who's the director of mental health for the Ministry of Health of Kenya, so has a great involvement in policy making and changing the face of mental health in Kenya. We also have a very young and dynamic youth leader, Yvonne. Yvonne comes, she is a program manager of Zumari Africa, and I just asked her what Zumari meant, and it means basically a musical instrument. So she brings in a lot of youthful energy, and you're going to listen to her about the kind of initiatives that have happened. And of course, we have Dr. Thara, who is a very well-known world leader in the area of severe mental disorder. She was till recently the director of the Schizophrenia Research Foundation in Chennai, in India, and has been a trailblazer in many new projects in India. So this is our wonderful panel today, and I'm going to ask Moitreyee to start off the discussion.
Great. So we're going to start with, sorry, we are figuring out the optimal distance of this microphone here. I'm sorry if it was too soft earlier and maybe too loud right now, but we're going to start with Pamela. And Pamela, given the huge breadth and depth of the work that you've done on mental health disparity and global mental health during your time at the National Institute of Mental Health, and all of the bird's eye view that you had of the different types of work happening across the world, we were hoping that if you could talk a little bit about that most serious mental illness start early on in life. And at that point, young people are facing a number of issues related to sexuality, reproductive health, relationship issues, substance abuse. How can we think about contextual action? And what are the different ways that we can think of supporting? And also perhaps some of the work that's happening in Seattle, where you are right now.
Wonderful. Thank you, Moitreyee. Thank you, the organizers of this conference. It's wonderful that this is happening, and it's a real pleasure to be here. I'm the only person that has slides, so let me just get my slides started. Okay, can everyone hear me? Great. So I will pick up on what Moitreyee said. I want to do three things briefly because we don't have a lot of time. I want to provide a global context for thinking about adolescents and young people and severe mental illness and the challenges people face. I want to make a plea. And thirdly, I'll tell you a bit about some of the early work that's happening in Seattle, focusing on first episode psychosis. So this is the complex picture of the life course. This box in the middle, which one is the pointer? This is the age range that we're focusing on, around young people and adolescents and young adults. And the point of this slide is that there are really myriad interacting factors that influence mental health trajectories, from biology, behavior, this says exercise, nutrition, sleep, to the people that interact with us, whether those are parents or peers. And all of these have an influence on executive function, on self-esteem, on social cognition, functional literacy. And this happens in the context of a culture, and it happens in the context of a built environment. What is your media information environment? Transport availability. All of these are influences on the risks and protective factors for mental health and well-being. So adolescence, as all of you know, is a period of dynamic brain development. It's considered a sensitive period for development. And I think it's important to realize also that this is the time when many of the symptoms of adult mental disorders appear. So you have risk of mental illness. But there are many intersecting risks that happen during adolescence as well. There's risk of HIV. There's the onset of drug use for some young people. At the same time, this is the time of sexual debut, of marriage, of beginning families. But neurologically, psychologically, young people, adolescents moving into adulthood, have changes in risk perception. There's often greater sensation seeking that decreases as they get older, and susceptibility to peer influences. So all of these things interact in this critical time. And if we think about what this means for mortality, what this means for longevity, we know that globally, both suicide and HIV are among the leading causes of death for adolescents and young adults. In the United States, I believe Michael Schoenbaum is going to be speaking either today or tomorrow. A really disturbing study found that the 12-month mortality after a new diagnosis of psychosis for people between the ages of 16 to 30 is 24 times higher than young people without these diagnoses. So we've got this period of time when, I said, around the world, both